Thank you for joining this Access Live event with Arapahoe County Government. The call will begin momentarily. Again, thank you so much for joining this Access Live event with Arapahoe County Government, Douglas County, and Adams County.
And thank you for joining us for this COVID-19 telephone town hall. If you'd like to ask a question, simply hit *3 on your phone and an operator will come and take your question. If you're listening online, you can type your question into the question box on the website. We are just beginning to dial out to households across Douglas and Arapahoe counties and want to give folks a moment to join the call. My name is Jim, and I'll be your host tonight. This is the fourth town hall that Arapahoe and Douglas counties have hosted since the start of the COVID-19 pandemic. Our goal is to bring you critical information that can help keep you and your family safe and also to answer your questions about the pandemic and resources that are available. We'd like to set the stage for tonight's discussion. Earlier this week, Governor Jared Polis announced that the stay-at-home public health order will expire this coming Sunday, and now we'll be moving into what he calls the safer at home phase. What does safer at home mean? And how does that affect the reopening the economy? The short answer is this: safer at home means that we'll still be doing many of the same things we've done for the past several weeks. Most people should stay at home as much as possible and avoid unnecessary social interactions. It means wearing masks in public and at work and practicing social distancing. And it means we need to continue strong protections for vulnerable populations. Tonight, we have representatives from Tri-County Health as well as Arapahoe and Douglas counties who will talk about the things that need to happen for us to stay safe as we reopen for business. They also want to share important resources with you for navigating these times. Now, we know you have questions. In fact, we already have many lined up, and we'll get to as many as we can on this call. A reminder, or if you're just joining us, if you want to ask a question, you can press *3 on your phone or send your question through the website. Let's get things started with an update from Dr. John Douglas, Director of the Tri-County Health Department. Dr. Douglas.
Yes, good evening. Very nice to be with you. So we are moving now into the end of our second month, almost the beginning of the third month of Colorado dealing with the COVID epidemic. This continues to be a major public health challenge, and it also is emerging as an economic challenge, not only because of the global issues that are happening with supply chains and other aspects that impact our domestic economy, but also, as already mentioned, the various social distancing steps that have been taken by the governor to try to prevent infection from being transmitted. That's obviously had a major repercussion on the community. Unemployment rates are at all-time highs, and our business community is really feeling it. Let me say that we have been able to, through the social distancing measures, accomplish a great deal. The estimate is that we have been able in the last 6 weeks through various measures to accomplish about a 75 to 78% reduction in how much contact we have with each other, as determined by how many cases we're seeing versus those that we actually had a pretty good chance, based on mathematical models, that we really would see. Now, that's really good news. Part of that good news also is that our hospitals have been able to build up their supplies of personal protective equipment, ICU beds, and ventilators, because hospitals being overrun was frankly one of the major panic buttons that we hit back in March when we decided that social distancing really needed to be taken seriously. Hospitals are not completely out of the woods, but we feared a northern Italy, New York style scenario here, and very fortunately that's not happened. So we're now at a situation where we still have cases. Our cases have flattened, but they haven't gone down yet. Our hospitalizations have flattened, but they also haven't gone down. And we do think it's appropriate to begin to think about what it means to get a little closer back to normal, and the governor's call that safer at home. And I really want to emphasize the earlier remarks that this is a step forward that we're all really eagerly looking forward to. But it is not unequivocally not getting back to life as we were living it in January and February. The governor's estimate is that we've been living at 75, 78% distancing. Safer at home is really looking at many things still being restricted or not as mobile as we'd like, so we can achieve about a 60 to 65% physical distancing. And we think that if we can maintain that, and if we can do a few other things, just to reiterate what you've already heard, good public health measures, trying to increase our testing week after week, still not doing enough, but we're getting better. Still doing ever better jobs of public health work, of identifying people who've been infected, having them stay in an isolation setting so they don't come into contact with other people, and having the people that have come into contact with them stay in what's called a quarantine setting so that if they get sick, they don't expose other people. And then we're very interested in the issue that's already been mentioned of protecting those that are vulnerable, those that are older than 60 or 65, as well as those with chronic underlying disease, continue to be the ones that get hit the hardest, whether it's hospitalizations, trips to the ICU, or even ultimately death. Masking is a fairly new twist on the horizon and not something that we are typically used to when you see photographs of Korea, Beijing, Singapore, Taiwan. It's not uncommon to see people with masks. That's not been our MO in the U.S. In fact, the Surgeon General even told us 2 months ago, don't mask. It's not going to help you. What he really meant was hospitals badly need the masks, and you don't need it as much as them. And by the way, if you wear a mask, we're afraid that you might get a little lazy and not do hand washing or other precautions. Now that our hospitals are better protected, we still don't want to be using those medical masks in the community, but there is absolutely a growing belief that wearing homemade or purchased cloth masks can be better than not using masks at all in terms of preventing transmission to others, and probably to a certain extent in protecting ourselves. So I think there's some good news that we're emerging into. I know that we're all eager again for the gradual reopening up of society, but I just want to level set for us. We are not out of the woods. The hurricane has passed, but this is not a 2-day hurricane. This is many, many, many months to come of hurricane-type living. And I think while it's incredibly hard for all of us to get used to the fact that the way we used to be able to move around and interact with others is not going to go back to that normal state soon. And that may be one of the hardest things to get our head around. The estimated time frame between now and getting a vaccine, which is what we really need to protect resurgent infection, maybe 15 to 18 months. So I think the more we can begin to accept this is almost wartime footing. We're in this for a year and a half or so, and trying to figure out what it means to live life as normally as we can, keep our businesses going as effectively as they can, maintaining our social relationships, and frankly, our mental health. Cabin fever's no fun. I think the healthier as a society that we can be. So thank you very much.
Thank you, Dr. Douglas. And we want to go to some questions here quickly. I want to start off with Mary, who has an online question for you, Dr. Douglas. How many deaths have there been in Arapahoe County not associated with an elder care facility?
So Arapahoe County has, as of our latest count, had just under 100 deaths, 96. And per the statistics we looked at this morning, 49% of those occurred in persons in elder care, and the other 51% were occurring in people living in the community. So about a week ago, it looked like more like 2/3 long-term care facilities. Now it looks like it's more about half and half. I would note that there have been major outbreaks in long-term care facilities that, because of the frailty of the people that live there, have been really devastating. We have not absolutely fixed the problem of sufficient personal protective equipment, testing, and optimal isolation of folks in those facilities, although we are getting better. And I think that getting better has translated into a reduction in those deaths, while the epidemic has continued in the larger community, and therefore a growing fraction of the deaths we're seeing are occurring in folks not in those nursing facilities.
Let's go to our next question, a live caller, Larry from North Highlands Ranch. Go ahead and ask your question. You're on live with Dr. Douglas.
Yes, I was concerned that we were going to relax the social distancing requirements. The last I read, Douglas County had the second highest rate of people with symptoms at 1.8%. The rate of doubling in our county was once every 23 and a half days. Denver County was only 19 days apart. And if you walk around the neighborhood where I live, I'd say easily 90% of the people are not wearing masks. So I think we're fooling ourselves, and we're setting ourselves up for failure, especially since we don't have enough testing to see how well we're doing. So I'm very concerned that we're just setting ourselves up for more problems.
Would you like me to reflect on those observations, Larry?
The death rate that we have right now acceptable, and are we willing to increase it? That's what it boils down to.
Well, let me comment on your observations. I think they're really important ones, and the forums like this are really helpful to me to kind of take a temperature on how people are thinking and feeling. All three of the counties that I work with, all of the metro counties, continue to have transmission of COVID. That's absolutely the case. I would say that Douglas County has, over the past couple of weeks, consistently not only had the lowest number of cases, but its case rate is actually beginning to drift down. Now, that's not gone, and we are still seeing cases in Douglas County, and we're still seeing people put into the hospital in Douglas County. But I do think that it's fair to say that at least through the current time period, things are looking relatively more favorable there. Now, I know there's been discussion in Douglas County about trying to open things up as soon as possible. I think this will have to be done cautiously. I'm reviewing now a second version of a plan from Douglas County about how that's anticipated to be done. I think the leadership of the county, including the public health leadership that serves the county, is going to have to be really attentive to numbers as they change, because there are gradual steps that I think may be reasonable to take, but how rapidly those gradual steps progress is really going to depend upon whether the progress to date has been mentioned. I want to also reflect on your comment about masking. Distresses me to hear that your observation is 90% not wearing masks. I think it's a challenge for all of us to figure out, if at all possible, what it means to enhance that mask wearing. It's not something that the governor, and certainly I'm not envisioning mandating. I think we're going to have to be more creative about what it means to encourage all of us to wear those more readily. Now, I will say that when I walk through my own neighborhood in central Denver, I see people wearing masks more commonly when they're together or close together. They shouldn't be right together in a park than I do when they're alone on the street. So I think we will see some differential like that. When I go to the grocery store, I'm seeing in my neighborhood about 80% of people wearing masks. But I think we're going to have to be really attentive to that not dropping off, because your point is really important, that if that's not maintained, all the testing in the world is not going to keep us ahead of the curve.
Thank you for that question. And again, if you've just joined us on this live call with Douglas and Arapahoe County residents, hit *3 on your phone. We'll get you into the queue and get to as many questions as possible. Our next question, you're with Dr. Douglas. Brittany from Commerce. You're on live. Go ahead and ask your question. Brittany from Commerce, are you there?
Yep. My question was just with following up with everything that's going on. There's a lot of anxious kids and stuff wanting to get out in the pools and the playgrounds. What does that look like in terms of opening up for metro districts or public rec centers and stuff this summer?
That's such a great question. It's not quite pool weather yet, but it's not far around the corner, and it's obviously nice enough for kids to want to finally get outside. Playgrounds have been one of the areas of our parks that were closed in the original order, and in the safer at home order, those continue to be closed. We have not yet really formulated guidelines around pools, but I'll have to be honest with you. I think pools are tough places to keep social distancing, which isn't to say we can't be creative and only allow a certain number of people in a pool at once. I'm seeing a lot of creative ideas coming out of our communities. It's quite clear to me that people like me in public health have good ideas, but not every good idea. So I'm actually quite interested in whether or not we can begin to think of innovative ways to allow things like playgrounds and pools to open and social distancing to be measured. But having had 4 kids and now 7 grandkids, it's really tough to herd them on a playground. And I'd say that until we begin to see how some of the initial steps at business opening works and making sure that doesn't result in a uptick in the virus, we're going to need to be careful, at least for the next month or so, about those settings.
And again, we want to thank everyone coming onto the call tonight. We're going to go away from question and answer just for a moment so that you could participate in a live poll question. We'd like to know your thoughts as we transition into this safer at home phase. Using your telephone keypad, please indicate which of the following statements represents your point of view. 1, don't move too quickly with reopening. 2, I don't trust other people will follow personal protection guidelines. 3, I don't know enough about what the best practices are. 4, let's get back to business, I'm not concerned. 5, I'm okay with reopening if masking and social distancing are still required. Again, I'll give you the number for your touch tone keypad on your phone. Choose the number, press the number on your phone, which most closely represents your opinion. And here are the 5 options. 1, don't move too quickly without reopening. Hit 1 if that's your opinion. 2, I don't trust other people will follow personal protection guidelines. 3, I don't know enough about what the best practices are. 4, let's get back to business, I'm not concerned. 5, I'm okay with reopening if masking and social distancing are still required. That's our poll question for tonight. Now we'd like to share more about a fantastic resource for residents in both Arapahoe and Douglas counties. That is AD Works. Arapahoe Douglas Works is a member of the Colorado Department of Employment's statewide network of workforce centers, which provide a variety of free services for job seekers and businesses. The network offers an array of tools to support job seekers, and including workshops, employment counseling, and training. In just a moment, we'll have someone to explain more. Let's go to our next question. Let's go to Beth from Aurora. You're on live. Go ahead and ask your question.
Oh, hi. I'm 70 years old with no underlying health conditions, and I've been very vigilant as far as staying in, wearing a homemade mask when I go to the grocery store infrequently. But I'm wondering if I have an appointment in a it's not a hair salon. It's just a one-on-one with a stylist. And we're both wearing masks. There's nobody else around. Is that a prudent thing to do?
Really good question, because a lot of our hair is getting longer, and we need a trim because hair salons have been closed. So hair salons and other personal services were closed under the stay-at-home. They are being opened up in communities under the safer at home order. I will note that some communities, the governor has noted some communities are apparently doing better and may be able to move faster down the opening pathway. In other communities where there may be more viral transmission, caution should be exercised, and he sort of left it up to local jurisdictions, counties, and public health to work that out. I will note that Tri-County is having conversations about where we stand in our counties and whether or not a slightly extended stay-at-home could be beneficial. I will also note, I mentioned the number of deaths earlier. Arapahoe County is the second highest in the state in terms of rate, number of cases, and number of deaths. So we're not taking things lightly. Having said that, when things do in Arapahoe County and Aurora begin to open back up, I think that would be a cautiously reasonable thing to do. I'd want to be sure that your service provider really is careful with the masking. Sometimes masks dip below the nose. Sometimes they come above the mouth. And you'd want to do the very same with your own masking. In that setting, by the way, your mask is helpful, but your service provider's mask is more important because we think transmission prevention is a bigger player than acquisition prevention. I would also, just tell you, do what you can. You're 70 and healthy, and that's great. But when we get to be that age, even if we're in pretty good condition, we have the risk of getting sicker faster. So the other provisions of hand washing, we've kind of stopped talking about hand washing so much, but still really important, I think would be a key part of that regular protection of yourself.
Let's go to another live question. Lori from Centennial, you're on live. Go ahead and ask your question.
Hi. Thank you for taking my call. I'm just very interested in why the testing and getting more testing is so significant, because it seems to me like if we just all act like we have it, we're going to protect others and ourselves. And if we have symptoms, we go to the doctor. So if we're tested, one day we could be negative and the next day positive, right?
Yeah, so that's really a good question, and I'll give you the standard medical answer, what I think is a reasonable answer, but I think it's an evolving question. So you're correct that if we're symptomatic and we just stay home and isolate ourselves, that should take care of the problem. But I would note that isolation is challenging for many of us, and frankly, if you know that the cold you have is not COVID, you don't want to be around other people and expose them. But frankly, especially if you're a healthcare provider or a first responder, which you may not be, but even if you live with other people, I would personally take greater precautions if I was COVID positive than I was not. Now, you may say, well, that's a marginal difference, and in some ways it could be. And you're also correct that we're not testing everybody, everybody who might have COVID who's asymptomatic, because at the extreme, that's measuring or testing all of us every day. But in a larger setting, if we can find out that you have COVID or I have COVID because I've got symptoms, then we would be able in a public health mode to do a much more aggressive identification of people you've come in contact with or I've come into contact with. So we make sure, A, you were exposed, B, you know what you actually do need to stay in isolation, which is a little bit of a hassle. That's 14 days. And if you get sick, even if it's the sniffles, you need to get tested more readily. So I do think operationally there are a number of differences, both in the degree to which we isolate ourselves, as well as the degree to which people we might have come into contact with would need to be treated and potentially tested.
Thank you, Dr. Douglas. And now we want to shift over to the 80 Works program. It's the Arapahoe Douglas Works, and it's a member of the Colorado Department of Employment's statewide network of workforce centers. Here to explain more about that is Kelly Folks. Welcome, Kelly.
Thank you. Good evening, Good evening, everyone. Arapahoe Douglas Works provides to job seekers a variety of no-cost employment assistance services that are customized to meet each job seeker's individual needs, and you can receive these services if you're 14 years of age or older. Job seekers can receive, like I said, free services through registering with the Workforce Center through Connecting Colorado at connectingcolorado.com. Some of the available services that we have for job seekers through our career services are access to one-on-one assistance with job search assistance, interviewing assistance, resume help and labor market information, access to employment counseling, access to hiring events with businesses that are hiring, and access to job openings throughout the state, access to free career and personality assessments and certifications, access to free job readiness workshops in areas such as interviewing, resume prep, salary negotiation, how to negotiate your salary, for example, etc. We also have access to other services. We have access to all these services virtually right now. Our resource centers, when we're open to the public, also have access to computers with internet access, fax and copy machines, courtesy phones, reference materials, and things like that that help you in your job search endeavors. We also offer talent development services, which may be available to our customers who have recently been laid off through no fault of their own, those who may need additional support finding and keeping employment beyond our career service options that I just mentioned, and or are displaced homemakers and are seeking employment, as well as we also provide services to high-risk youth. Through these services, an individual can receive intensive job search assistance, more intensive one-on-one counseling, and potentially training opportunities to help get a better job. The best way to access these services right now is by calling our COVID-19 emergency call center at 303-636-1160, or you can also go to www.adworks.org. We also provide an array of services for our business community, and these services include a wide variety of no cost, it's free, services to help our employers meet their recruitment goals and to ensure a qualified workforce is available for them. Our business development representatives are very experienced in listening to your needs, providing solutions to save the business time, and also being able to provide several valuable resources. Some of the services that are provided to businesses include helping businesses list their job postings and find qualified employees who meet the positions criteria that they're trying to fill. We are able to host hiring events both in our workforce center and virtually, which can be customizable to the business, as well as we can provide pre-screening of their candidates, resume screening, and interviewing can also occur. We also provide access for businesses to utilize no-cost assessments to gauge a job candidate's or employee's skill set or personality type, assistance with layoff resources, and unemployment insurance information is also available, assistance with labor laws, wage and hour, special populations, and tax credit programs that are available for a business. We can also provide assistance with connecting a business's existing employees with workshops, certifications, and trainings to hone their skills in order to add value to the business. We can provide guidance on writing effective job listings and job descriptions. We can provide targeted marketing and outreach to qualified candidates, access to hiring and training incentive and cost-saving programs, job profiling, and also we can provide supplemental training and education options for businesses and employers or potential hires. So if a business needs assistance, they can call directly to 303-636-1359 or go to our website. Also, just want to mention that we have services as well, as all of these services are available at the website, but we also have developed COVID-19 resource pages specific for both the job seekers and the community, and also specific to businesses that are available at adworks.org. And the COVID-19 resource pages will help link you all to resources for ADWorks, but also resources for unemployment insurance information, resources for filing a wage complaint, resources for applying for a small business loan, and other needed resources that you might need during this pandemic. And so there's a lot of different options available, and they're all free. You can visit our workforce center, but there's also workforce centers. We provide services in Arapahoe and Douglas County, but there's also, as they stated earlier, we're part of a state network, so there's a Workforce Center in Adams County, Denver, Jefferson County. So they're all over the metro area. If you don't live close to us, you can go to one of those as well.
Thank you so much for that.
Basics of everything, so thank you.
Great. Thank you so much, Kelly. And again, if you're on the line and you have any questions, particularly about 80 Works, it's *3 on your phone. With that, we'll go to an online question. This person asks, I'm a business owner and need to make payroll. How do I do that? And are there any resources for me? Kelly, do you have an answer to that?
Sure. The appropriations and the legislation that came out are out for the Payroll Protection Program loans. No money is currently available in those, but however, 28 new lenders, mostly credit unions, have signed up to do Payroll Protection Program loans. More information is available through the Small Business Administration site at https://www.sba.gov. If you want to go there, you can also go to, again, our Corona Resource Virus page, and we have a link there, or you can call one of our business representatives, and we can assist you with getting that information as well if you're having a hard time with that.
Thank you so much, Kelly. And we want to go to another question for Dr. Douglas. This is Craig in Centennial. Craig, you're on live. Go ahead and ask your question.
Yes, I actually had two questions. The first one was, when do you think it would be smart to start youth sports, knowing that we have like baseball, lacrosse, where there's going to be between 50 and 100 people out at the park? And then I'll ask my second question is, will the cities or what government leadership will be providing specific guidance for those organizations? Because I'm actually heavily involved in it, and I think that a lot of them are trying to come up with their own solutions, and I'm not sure they're in the best position to do that.
Yeah, so Craig, really good questions. When to start? Today's April 23rd. We're starting stay-at-home on Monday. We're going to see whether things continue to improve or whether things begin to get worse again. And I'd say that it's a little dependent upon how that trajectory goes, number one. Number two is, it may be community-specific. If we begin to see continue to see reductions in Douglas County. Centennial has had a fair number of cases, but we're trying to track on things by community as well. There may be able to be some community differences. You can tell I'm hedging because I honestly don't know for sure. I think part of it, you mentioned people can be innovative, and they are being innovative, but are we going to get any guidelines? That is not something that we've actually currently flagged as a guideline, an area of guideline production, but I'm going to make a note to talk to our team. I'm also not sure whether this is something the governor's office, which is busily developing guidelines for lots of sectors, might be doing, but I think it's a really excellent question. Maybe I should leave it as a when to start, not yet. Let's see how the next month goes. Guidelines. Let me do some homework on that. I don't know how to get back to you directly, but I'll certainly explore it, and we'll see what we can begin to provide.
Thank you, Dr. Douglas. We're going to go to another question for you, Doctor. Aaron from Littleton, you're on live. Go ahead and ask your question. Aaron from Littleton, go ahead and ask your question. You're on live with Dr. Douglas. Last time, Aaron, if you're ready. Okay, we'll go to Cindy from Aurora. Cindy, you're on live. Go ahead and ask your question.
Yes, I'm a little confused because on my local news, Channel 4, at 5 o'clock, they had breaking news that said Tri-County had extended the stay home until May 8th. Now, does that supersede the governor's order, or and I do have another question regarding rent, but if you could answer that one first, because is this May 8th? Is that a correct date? And or did they get something wrong on the news?
Cheryl Turns, can you take that? Oh, sorry.
Okay, on the local news at 5 o'clock on Channel 4, they said Tri-County had extended the stay-at-home until May 8th. Is that correct?
Can you hear me? This is Dr.
Yes.
Yeah, okay. So Tri-County has been watching the governor closely this week as he moves towards safer at home. We have been having conversations with all three sets of our commissioners about where we stand. We honestly are concerned because Arapahoe County, Aurora, and Adams County are among the warmest / very warm spots in Colorado right now in terms of transmission. And while we are really eager to get all kinds of businesses going again, we want to do so in a way that we don't have to be a yo-yo, because every business owner I've talked about, sort of the worst case scenario is being jerked around and closed again. We have been looking at whether or not a couple of extra weeks of, quote, stay at home could be beneficial. We have talked about, should it go 2 weeks from the 27th? That would be May 11th. Should it go 10 days from the 27th? That would be May 8th. Should it go halfway through May 15th? We have not met with our Board of Health yet. We're doing that at 12:30 tomorrow. We'll be discussing both the status of the epidemic and thoughts we have about that question. So it is absolutely something we've been discussing, and ideally would be done in a coordinated way with other counties who've got ongoing high levels of the epidemic, because we think that would, frankly, be more effective and a little more less confusing for folks living in different counties. But officially, we have not and cannot decide until we meet with our Board of Health.
And thank you all again for joining us, and thank you, Dr. Douglas. We're going to go to a quick poll question. Again, if you'd like to get your question in line, go ahead and hit *3 on your phone. We're going to ask you a poll question, and I'm going to give you specific instructions on how you can respond. Here's the question. We'd like to make sure you stay informed about what's happening in Douglas and Arapahoe counties. That includes our regular town halls, where we discuss all of the great services your county offers. If you'd like to continue receiving information from the county, please press 1 on your phone now. Again, if you'd like to receive this excellent information from your county, please press 1 on your phone now. And Dr. Douglas, we've got another question. This is Janet from Littleton. Janet, you're on live. Go ahead and ask your question.
Okay, can you hear me?
Yes.
Okay, the basic question that I gave the call screener is that I'm concerned that based on the numbers, and I've been following and tracking this very closely, with 64% of the COVID instances of death are greatly in the assisted living facilities and nursing facilities. And widespread throughout Colorado, our numbers are pretty low. And in particular, in Tri-County, I'm concerned, why aren't we opening up and moving toward a platform? We've had enough time to flatten the curve. We've had enough time to assess the numbers. The hospitals are perfectly staffed. In fact, a lot of them are complaining they don't have enough activities going on at the hospitals. Why wouldn't we now move toward an education platform where we are, like with this great call, we are reinforcing with our neighbors and people that we are associating with the social distancing and the hygiene, and get back to living in Tri-County?
So, really good question. It goes back to the theme of, when is enough? When can we begin to go back? I want to just clarify a few things. The curve is beginning to flatten. It's certainly not begun to tilt down. We'd like to see it tilting down, but you're not going to stay closed down forever waiting for a tilt. Although if you don't get a tilt, then you've got to be ready for the resurgence. Secondly, I do want to clarify about the hospitals. The hospitals are clearly getting better. But the reason they seem empty is that elective surgery procedures have been canceled. It appears the governor is going to continue that cancellation a little while longer. It's not for social distancing. It is for personal protective equipment and ventilators. And while the ventilators have been beginning to come in better, the personal protective equipment remains sporadic. Now, I'd like to see the hospitals get going as well, but that, just to explain to you, that's why the empty appearance. And frankly, as you probably know, the hospitals are suffering economically. They're still in place. You would think this would be a golden time for them, but the cancellation has resulted in their revenue stream being impacted again. I think the answer to why not right away is basically got to do with what could be done more effectively over, I just mentioned could be May 8th, could be May 11th. Might not be any of that, by the way, Janet. The idea there is to bolster the testing somewhat more, bolster the contact notification somewhat more, give us a chance to bolster the personal protective equipment, and also at the same time begin to educate our businesses about what it means to try to maintain proper spacing and proper social distancing. You're absolutely right. It relates also to the masking question. That's really critical. We put out a press release about 30 minutes ago about an event not in Littleton but in Aurora, where we had an outbreak of COVID among employees of a Walmart there with 3 fatalities. Now, that's not to say that, that kind of thing still couldn't happen, but that sort of thing really gives us pause in terms of making sure that the parameters of good social distancing are in better place, and that we have got a curve that we're beginning to see going down, or at least flattening out a little longer. So I sense the impatience, if not frank frustration in your voice. I hear a lot of this. I feel it myself. But that would be the reason for that slight extension.
Now let's, Dr. Douglas, we got another question. This is Carolyn from Aurora. You're on live. Go ahead and ask your question of Dr. Douglas.
Yes, doctor. I was wondering, when you're walking outside with 1 or 2 friends, do you have to wear the mask?
These are friends. I don't know if you can still talk to me or if they've cut you off. I'll hypothesize here. If these are not people that you live with, but are people who might themselves periodically have contact with other people, like they go to the grocery store, that kind of thing, I think it would be wise to do that. Now, if you're walking side by side, 6 feet apart, which may be hard because the sidewalks aren't that wide, arguably the masks don't provide quite as much importance. But frankly, if you're close to each other and if you turn your head to talk to each other, or if somebody tells a joke and you laugh, and I only mention that because laughing, like sneezing, exhales more breath, which can exhale more viral particles. I think it would be wise for all of you guys to be masking. If should any of you have it, you can reduce your risk of infecting the other. And again, if your friend has it and you don't, you can somewhat reduce your own risk.
Well, we're about halfway through our telephone town hall discussion about the road to recovery. Now we'd like to bring in Dan McElkey from Douglas County Human Services, and Cheryl Turney's from Arapahoe County Human Services. There's a good chance you've never needed to interact with our human services departments before, and that is a good thing. But we also realize that this COVID crisis has created the need for many to learn about the programs that Human Services offers, such as assistance for childcare, energy, food, financial, medical, and mental health needs. Dan will give us a general introduction and then answer some questions.
Good evening. My name is Dan McElkey, and I'm the Human Services Director for Douglas County. I'd like to cover 2 programs that may be of interest to the callers tonight. One is the Colorado Works program, which is an income-based program that allows for cash benefits as well as case management and job help for people who find themselves unemployed or underemployed or have barriers to their employment. That program can be accessed by applying through the Colorado Peak system that we referenced referenced many times on the other calls, as well as if you do not have access to the internet, you can come up to either the Department of Human Services in Douglas County or in Arapahoe County, and there are paper applications for you to fill out in a locked box to be able to submit your application for the program. The second program that I would highlight is the Child Care Assistance Program, referred to as Ccap. It is also an income-based program that allows for government-assisted child care for people who are searching for work, also income-based, as well as people who are working and cannot afford child care without some help.
Cheryl, can you share something with us?
Yes, good evening. I'm going to talk about our food assistance program and Health First Colorado, which is our Medicaid program. The food assistance program assists individuals and families getting the cost of food covered. This program is a supplement to a household's normal food budget, and once approved, food assistance benefits are issued on a Quest card, which works much like a debit card. Eligibility for food assistance is based on the size of your family, the amount of income, and expenses. And you may qualify if your gross monthly income is at or below 130% of poverty. For example, if you're a family of four, you can qualify if you earn up to $34,000 a year. And right now, because of the COVID-19 situation, there are two important waivers in place. One is that we no longer are requiring an interview, and that will happen through May 31st, which basically means that we can get benefits out the door much quicker. The other is that we are issuing a maximum allotment through May 31st, so it's not based on your income. And for example, a family of four can receive $646 a month to help with their food costs. The Health First Colorado's Medicaid program is free or low cost, basically public health insurance for Coloradoans who qualify. And that benefit covers doctor's visits, emergency care, preventive care, and also behavioral health. And to apply for either of these programs, you can visit Colorado Peak, and you can also download the app called My CO Benefit. Thank you.
Thank you so much, Cheryl. We're going to go to a question for Kelly Folks. It's Tina in Byers. Tina, you're on live. Go ahead and ask your question.
Hi, I'm on a 20% furlough right now. I have, put in for unemployment, and I'm wondering, so I have a three-part question. So I'm wondering, first of all, do I need to do the applications, 10 applications a week, even though it's only 8-hour furlough per week? My second question is, if my company ends up, either going under or where I find myself fully unemployed, is taking the unemployment right now going to hurt me later when I would need full-time help while I'm looking for a job? And then also, could you explain how the $600 a week benefit works if I need to do anything extra for that? How does that play in right now?
Sure, thank you. For the first part of your question, no, you do not have to do the 10 applications a week. That's been waived for right now. As far as will your claim, putting in a claim now hurt you down the road? No, they're going to base it off of your income. They have also extended how long you can receive unemployment, so it should not hurt you down the road. And then as far as the $600 a week goes, that is as long as basically anyone that applies that even gets $1 of benefits of any program will automatically receive that $600. So they'll automatically get that as part of their claim. So I would say, you would probably be fine applying for it. You would be eligible for the $600. And for sure, you will not have to do the 10 apps because that's been waived right now. If you would like to call our COVID-19 emergency call center, you can do that as well, and we could help you through any of the exact logistics as well if you need additional assistance.
Great, and we've got a question for Dr. Douglas. Charles from Centennial. Charles, you're on live. Go ahead and ask your question.
Yes, it concerns the mail and the newspaper. Are there significant risks of possibly bringing the virus into your home and becoming infected by handling the Daily Mail and or the delivered Denver Post newspaper? And if so, what are the recommended procedures for handling the mail and the newspaper? Is it safe to set the mail and the newspaper on household surfaces?
So, Charles, that's a really good and important practical question. Figure out how we live in the world. This information available right now is that small chance of, let's say, or the person who puts your the safest advice is to treat the mail as though somebody could have touched it, not to be, too paranoid about it, because there are so many ways that one could imagine corner. But the way I with it, and wash your hands. Ideally.
Dr. Douglas, you're breaking up just a little bit. If you can get to a better place, we can hear you. We might take that question again.
Did we?
Go ahead.
Yeah, I'm sorry. Did I totally lose that? Apologies. Sorry. Start quickly. Charles, mail, newspaper, possibly could have been touched by somebody with COVID. Don't believe the virus lasts very long on those sort of paper services to be safest. If you put it on the counter, clean the counter off after you use it. If you open the mail, throw it away, recycle it, and then wash your hands. For the newspaper, if you sit down and read it, wash your hands after you read it. If you're like me and you read it through the day, try to remember to wash your hands as you do it, and then clean the counter if you put it on your kitchen counter or something after you use it. These are precautions of protecting yourself against, frankly, what I think is a very low magnitude risk, but that would be a way of reducing the low magnitude risk even further.
And Dr. Douglas, have another question for you. Shelley from Centennial. Shelley, you're on live. Go ahead and ask Dr. Douglas your question.
Thank you. How important do you think contact tracing for positive COVID tests are? And how much tracing are we doing right now? And how much would you like to be doing?
Well, I would say that in an ideal setting, contact tracing could be very useful. And we're basing that on both theory, but we've got more than theory. We've got examples of at least an initial, almost best in world response of containing the epidemic from South Korea, where they used a number of different tools, one of which was much more per capita testing than we are able to do here, and then much more aggressive, and by aggressive I mean lots of people doing lots of work, contact tracing. We're doing very little of it right here now. We've started doing more of it in settings where people might have contact with long-term care facilities, but frankly, because of the large numbers we have, we've been putting the primary focus on case investigation, somebody who's actually got the infection, making sure they get counseled about staying in isolation, maybe making sure they've got, the ability to get food and drugs and whatnot to stay in isolation. Modeling suggests that if we did, and modeling, a lot of models around, some models have good names, some models have bad names, that if we could do modeling, or rather contact tracing more effectively, it could make a major impact on containing the epidemic. Part of the reason that I would really love to see our number of daily cases go down before we open up, because opening up has some potential, even with the best of education, and meaning cases go back up, is that there are frankly fewer numbers of cases every day, which not only reduces the chance of somebody being exposed to them, it also means that these, frankly, quite labor-intensive technologies like contact tracing have a better chance of actually being able to be done. If you're dealing with dozens of people a day, it's much more plausible to be able to do that than if it's hundreds or more than that. The last thing I would note is that there's a lot of interest in electronic aids to contact tracing. Some of those may be amenable to our society, being able to use apps, for example, to have people notify other people they may have been exposed to. Others, South Koreans, use credit card data, closed-circuit TV monitoring, and surveying phone records. Things that right now I don't think a society of the U.S.'s value structure is likely to want to very warmly embrace. So I think human-based is something I'd really love to see more of, and that's how I think it could be helpful.
And Dr. Douglas, you have another question for you. This is Tricia in Highlands Ranch. Tricia, you're on live. Go ahead and ask your question.
I was wondering about projections about childcare this summer.
Yeah, so childcare has been really restricted. It's been thus far provided only for essential workers, or rather allowed to be provided for only essential workers, which is obviously a huge detriment for parents that are not in that category. The Safer at Home guidance, which the governor will be introducing statewide on Monday, does allow for childcare to be opened back up, to be provided more broadly with, quote, strict precautions. Devil's in the details. Those strict precautions are being developed. It's almost certainly going to be masking, certainly for the staff. Tough to get kids to mask. We're sort of discussing with different sort of child care experts what's a level at which we could really expect to see that. Probably lots and lots of hygiene, because while I sort of said the mail, I'm not so worried about it. In a child care center with shared toys and things like that, I'd be more concerned about it. So as we get statewide and then hopefully pretty broadly into the Safer at Home place, we ought to be able to see child care return as we define those, quote, strict precautions.
Dr. Douglas, thank you so much. And everyone, before we leave, we'd like to give a few of our county commissioners a few moments for comments. First, let's check in with Douglas County Commissioner Abe Layden.
Hey there, everybody. Am I in?
You are. Go ahead.
Hello? Okay, great. Well, hey, just wanted to express my gratitude to our partners in Arapahoe County, certainly everyone from Douglas County on the call, and the phenomenal Dr. Douglas. I know this has been an incredible amount of work for a significant period of time here. You know, I mentioned this on a call earlier today, but we know this is a marathon, not a sprint, but we're starting to see the light at the end of the tunnel. And I think we're very encouraged by the hard work and the sacrifices that our community has made to stop the spread. And in the meantime, we're going to be paying attention to metrics alongside our partners to ensure that we're able to phase toward freedom in a way that makes sense with the experts and with the good data that we're getting. So incredible thanks to our partners and everyone on the call. Appreciate it.
Thank you, Commissioner Layden. And now we'll go to Douglas County Commissioner Roger Partridge. Go ahead, Roger.
Thank you. And I think Commissioner Layden said it very well. As we pay attention to our community, and certainly in great cooperation and belief in Dr. Douglas and Tri-County Health, we are ready to certainly see what our next steps are. And I think it's been obvious to many in the community. We can take that, but it's only with reflection on what the current conditions would be. So we will be very attentive to anything as we move forward, but certainly really appreciate everyone on the call and Dr. Douglas and Tri-County Health for all their hard work, because it's been a monumental task. And everybody has really pitched in, and that's really what it takes. We're all in this together. Thank you.
And now let's hear from Douglas County Commissioner Laura Thomas.
Thank you. I'd like to thank everybody who called in this evening and listened. I'd like to thank Dr. Douglas for the time and patience that he has exhibited over the many weeks that we have been seeking input from him. And finally, I would just like to let the citizens of Douglas County know that we have been watching what you have all been doing, and I am amazed that I have seen people out walking and exercising, riding bikes, and I see smiles on people's faces. And I think that people have a lot of internal courage, and they know that we're going to get through this. And I would just like to applaud the residents for, weathering this so well, and that by praying and reaching out, we can get through this. So thank you.
Now let's hear from Arapahoe County Commissioner Jeff Baker.
Thank you, Jim. Thank you, everyone, for joining us here tonight. Thanks also for following our health officials' guidelines during this unprecedented crisis. Doing things like maintaining social distancing, wearing masks in public and at work will become even more crucial as we move into the next phase of this situation. The title of tonight's town hall is Road to Recovery. So we're asking you to please continue to do everything you can to keep yourself, your family, and those around you as safe as possible, particularly as we begin returning to our everyday lives. Thank you again for joining us tonight.
And finally, let's hear from Arapahoe County Commissioner Bill Holen.
Thank you very much. I'd like to echo Commissioner Baker's gratitude for all of you. These difficult measures will only be effective if we all follow them, and we appreciate the sacrifices you've already made in this process. As we've learned on the call tonight, the information about the virus and our collective response to it is changing rapidly. Arapahoe County Commissioners are gathering data and meeting with the appropriate experts so we can make the soundest decisions about how we go forward. We're anxious, as you are, to begin opening our offices, our businesses, and our community again. And we're very grateful for your cooperation and patience during these very trying times. Thank you again, and we hope to see more of you in person as soon as possible.
We got some excellent information tonight. We want to thank you so much for joining us. Be well. As a reminder, we will post a copy of this recording to our website in the next 24 hours. Thank you very much.